Persistent pelvic floor muscle tension and tightness can feel very uncomfortable. It can contribute to or worsen pelvic floor conditions such as pelvic pain, sexual pain, urinary incontinence, difficulty peeing or pooping, and sexual dysfunction. I'm Dr. Susie Gronski, Doctor of Physical Therapy, Pelvic Floor Specialist, and Certified Sex Counselor and Educator. And in this video, I'm going to walk you through 6 yoga-inspired stretches to help relieve pelvic floor muscle tightness and tension. For each of these stretches, I encourage you to pause at the first sensation you feel. Avoid pushing or straining in any of the positions, as this might involuntarily cause pelvic floor muscles to guard and tense. In addition, I am going to invite you to connect with your breath. Breathe soft, slow, and steady into the lower belly, which will then in turn help to relax the pelvic floor muscles with each breath. Okay, so let's get started. The first stretch is child's pose. Kneel on the floor, bring your big toes together, and sit back on your heels. Reach your arms forward and lower your chest towards the floor, letting your belly rest between your thighs. Take several slow, soft, and steady breaths into your belly and allow your pelvic floor muscles, hips, thighs, and butt muscles relax. If you're looking for a variation, you can explore knees together versus apart. Or place a bolster underneath your head and chest and allow your body to melt into this position. I also encourage you to explore right and left torso bending in this position. The second stretch is called cat-cow or pelvic rocking. Start on all fours. As you inhale, arch your back, cow pose, and as you exhale, round your back, cat pose. Try to synchronize your breath to the movement, going at your own pace, breathing in and out into your lower belly, and allowing your pelvic floor muscles to let go and relax. The third stretch is frog pose. Start on all fours. Slide your knees outwards, keeping them in line with your hips and shins parallel to each other. Lower onto your forearms and let your hips sink towards the floor. Hold for several deep breaths. If this is feeling challenging, explore with different variations, such as try to bring your knees closer together. Prop up on your forearms. Explore rocking back and forth in this position. Use a blanket or roll up a yoga mat under your feet for extra cushion. And you're welcome to use a bolster or pillow in between your knees to support your torso and your head. The fourth stretch is the butterfly stretch. Begin lying on your back, bending your knees, and bringing the soles of your feet together. Allow your knees to fall out to the sides, forming a diamond shape with your legs. Rest your attention here and breathe slow, soft, and steady for several breaths. A few variations to explore here is to bring your feet supported on the wall or allow your feet to be supported on the ground. The fifth stretch is called deer pose. Sit on the floor with your legs extended. Bend your right knee, placing your right foot behind you near your right hip, with your shin parallel to your side. Bend your left knee, bringing your left leg in front of you at a 90-degree angle or whatever is accessible for you, with your foot pointing forward. Sit up tall but comfortable, keeping your sits bones evenly grounded, and rest your hands on the floor or the front of your knee. Variations for this pose include folding forward, incorporating a spinal rotation or twist. Maybe you explore a spinal rotation and a forward fold. Or you add an active movement here with some pelvic rocking, with the torso facing the front leg, rocking your pelvis forward and rocking your pelvis back. Again, explore whatever movements feel comfortable for you. And lastly, stretch number 6 is the standing wide straddle forward bend. Stand with your feet hip width apart. Hinge at your hips and fold forward, letting your upper body hang down. You can bend your knees slightly if you need to. Some variations in this pose include an arm cradle dangle, clasping your hands behind your back, adding some 3-point touches, so active movement to help engage some of the back muscles and stretching the nerves and connective tissues around the pelvic area, lower back, hips and thighs. You can also do some right to left sweeps. Again, explore syncing these movements and positions with your breath pace. Do whatever number of repetitions feel comfortable for you. If any of the movements or positions that you explored with me today feel uncomfortable or like they're worsening your symptoms, please listen to your body and get individualized support from a pelvic floor therapist. Thanks for watching. If you want the real uncensored scoop on all things pelvic and sexual health, join me on Patreon. You know, in case YouTube thinks my content is a little too spicy. Let's learn, laugh, and get real about your private parts together. See you next time.